On the 14th of February, we'll have a major official launch on the 14th of February. We would have launched it today, and that's where Melinda Gates, may I just call you
Sure,
Melinda,
please.
address you, had planned to be here today, but then today, of course, was not possible. Also, His Excellency had also the launch of the bursaries and so forth. So we moved it to 14th of February. But you know, this drug, it's there in the private sector. People have to pay. It's quite expensive. What we are doing now is introducing it where we will give it to all our children like we give all the others. You know, we have these vaccines which we give regularly, like when the baby is born, they are given so many. So it will be a regular vaccine, which will be now accessible to all our children. We did not introduce it, you're right, last year, and you had me allude to it a bit earlier, because there was a problem with the pricing. Gavi were not getting it at the price that they could give it to us at a price we could afford, so that it's open to all people, all children. And I did not want a situation where the people who are manufacturing had offered that we get a trial, or we will give to Kenya 1 year, a short trial, I think one year trial. And I thought that's not what we wanted. We wanted something we can sustain, and something that will be accessible to all the children, not just a few. And that's why we waited. And then we have been negotiating with Gavi, and then you can see Melinda Gates and Bill Gates Foundation, they also support Gavi, so they made it possible, and others, for us now to be able to access at a price we can afford for all the Kenyan children.
First need to prevent these, 1.6 million children's deaths from pneumococcus and rotavirus. We want to get at the huge number of deaths first. So Bill and I concentrate on the vaccines where we can both bring the price way down and that will affect, millions and millions of children. HPV is probably on the list, but much further down because of the amount of death that it causes today. And on maternal deaths, I think there are also things I know that you all are looking at in your own country too, that you can do that are less expensive for some of the maternal deaths, which is literally just making sure the women get to the healthcare facilities. And I know a lot of the other developing world countries, that's part of what they're doing is policy changes and driving the women into the facilities, and that's starting to bring the deaths down too. So I'm with you, I'm passionate about HPV myself, but I want to get first the childhood deaths where we still have millions of them, and then move to this piece of it for maternal as well.
Yeah.
Announcement on the 14th,
Yeah,
it's terrific,
yeah.
really terrific.
And our best wishes, and we